Hello, I'm Laura Siminoff, Dean of Temple University's College of Public Health, and joining me are our faculty experts, Graciela Jaschek, Sarah Bass, and Krys Johnson. Since we spoke 2 weeks ago, we've seen yet another spike in the number of COVID-19 cases in the country. The average number of cases per day in the United States had been dipping down, but now it's above, on average, about 40,000 per day. It tells us that we just can't let our guard down. So some of the problem seems to be that there's just so much misinformation about the virus, how it spreads, how people can keep themselves from becoming infected. So we're going to talk about that today. And I'm going to start with Graciela. Graciela, could you talk about the death rate of people who have COVID-19? And if it's true, is it really only older people who die from this disease?
Okay, yes, Laura. I think that rates can be very confusing. So I'm going to talk about, for instance, a piece of disinformation that was spread via social network early in the fall. And that was at the end of August, the CDC updated their latest numbers on the pandemic, as they usually do on a weekly basis. In that update, the CDC stated that of all COVID-19 deaths, only 6% of the deceased had no underlying medical conditions. Typical underlying medical conditions include obesity, diabetes, immunocompromised conditions, or heart disease. So according to the CDC, of the 100% of people who died from COVID-19, only 6% died from COVID-19 alone. The remaining 94% of deaths were caused both by COVID-19 and underlying medical conditions that contributed to the risk of death. So for example, someone who has diabetes might otherwise have lived many more years if they had not gotten infected with the novel coronavirus. So although the risk of getting severely ill and dying from COVID-19 is greatest at older ages, 65 and older, underlying medical conditions increase risk at any age. Another serious concern for the young is becoming a long hauler. According to research studies, the hospitalization rate among people 30 years of younger is around 1.2%. But 9 out of 10 hospitalized people suffer long-term symptoms such as chronic fatigue, shortness of breath, unrelenting fevers, gastrointestinal problems, and so on. This is what is known as being a long hauler, and it is a real risk both for the young and the old alike. So my last word is, numbers can be confusing, but pay attention to the fact that if you are old or young, underlying medical conditions can increase the risk of severe illness and, in the worst case, death. And in addition, both old and young people can develop long-term debilitating symptoms after infection.
Thank you. So that's really, really helpful, because I think a lot of young people feel that they're immune, but it sounds like what you're saying is that once you have this illness, you are at very high risk for having long-term health problems, even though you've survived the disease.
Exactly.
Okay, so Krys, let's turn to you. So we just saw a huge outbreak in the White House, and again reminded us that wearing a mask is critically important, and that no matter how many times you are tested, you can still get this disease. So one of the things that people always talk about is the 6-foot rule. It's as if people believe that if you're 6 feet away from somebody, you're kind of have a little bubble of immunity around you. So what would you say about that? Is that true? What do you think about this sort of 6-foot rule?
So that 6-foot number actually comes from an older study, and I think we've repeated it so often since January that it does sound like it's a magic number. But that study was done with a completely different disease, and it was really just looking at the amount of droplets that come out of your mouth whenever you're speaking or singing or things like that. And on average, the majority of those droplets do settle within the first 6 feet. So that would be great news for us if COVID-19 were spread exclusively via droplets. And then it would actually be a magic number. But again, since January, there have been a lot of scientists who studied this. And some have found that coughs and sneezes can make those particles travel as far as 23, 27, or 30 feet when not restrained by a mask. So the important thing that we've learned about is during that time frame is these aerosols. So these are teeny tiny little viral particles that can actually linger in the air for 30 minutes to several hours, depending on which study you're reading. But that's after an infected person has left the room. So you could be in a room by yourself, but an infected person has been there, their viral particles might still be there. But if you're wearing a mask and you're that infected person, then there's going to be less of those viral particles and probably so little left in the air that you wouldn't be able to infect another person. So as long as you wear a mask, you're less likely to infect other people. If you're wearing a mask and keeping 6 feet away, then the likelihood of spreading to other people is remarkably small. But in the case of the outbreak that we just saw at the White House, we had folks who were outside, which is great, but they were sitting side by side and they were not wearing masks. So those two things combined made kind of this perfect storm for these viral particles to kind of travel from person to person. And you'll see like there were several people within 6 feet. So if you are outside or in an otherwise well-ventilated area, those particles that I've talked about, those aerosols, might disperse more quickly and reduce your risk. But even if you're outside, obviously we see now that just being outside isn't going to protect us. So we should still be masking up whenever we're going to be around people and trying to keep 6 feet. That's not an or proposition. Do mask up and keep your distance. So really just all the more reason to wear a mask and get outside more too.
That's really, really good advice. That sounds very sensible to me. So finally, Sarah, so after listening to Krys and Graciela, how do we get rid of these misconceptions despite all the evidence to the contrary? How do we talk to people who are not following the recommendations? And I just worry that at this point that it's become so political and it's almost as if there's some sort of conspiracy theory going on around about that. It's just some strange people trying to shut the country down for some nefarious reason or another.
Yeah, unfortunately, I think what's happened is that we've moved from misconceptions to these kind of conspiracy theories. And, conspiracy theories are as old as time, whether it's who shot John Kennedy or did we really go to the moon. A lot of time believing these kind of misconceptions or conspiracy theories surface during times of uncertainty, right? Like with COVID-19. And then it's exacerbated by the presence of things like social media where things can be really rapidly spread. There was a recent study that indicated that almost 1/3 of all Americans believe some type of conspiracy theory about the coronavirus, which is kind of shocking. There are psychological traits of people who tend to think this way. They tend to be people who are pretty distrustful, generally, of anyone or anything that's new. They have what psychologists call low agreeability, which means that often they are not dependable types of people. They're often not very kind people, and they're very highly focused on their own interests. Probably most importantly, I think they tend to overestimate the likelihood of co-occurring events and to attribute intentionality where it is unlikely to exist. So a good example of that is believing that 5G cell towers are the cause of COVID-19 because they started appearing at the same time. These people also tend to be pretty socially isolated, so they often use social media as a way to try and connect with others like them, and that just kind of exacerbates this spread of miscommunication. So how do we talk to people who believe in conspiracies and who kind of go against recommendations? Well, probably the first thing not to do is come armed with facts and evidence, because their beliefs usually are not really rational. So when confronted by facts or evidence, they just will dismiss the evidence as false and say the messenger has some type of agenda, which I think we've seen a lot of. So what do we say? I mean, one thing we can do is, the more we can try and respect the person and be empathetic to try to appeal to their values. So you might ask someone, why aren't you wearing a mask, instead of telling them to wear one? Because that might at least allow for some dialogue about, or problem solving, or give you an opportunity to kind of support by someone, to say, oh, well, I relate, but, so trying to be non-judgmental and hearing what the concerns are is sometimes the best thing to do. In the end, though, if someone won't wear a mask, you're probably not going to be able to force it onto someone. So as we just heard, the best strategy, at least for us, to try and protect ourselves is to stay away from them, at least 6 feet or more, and to wear a mask.
Well, thank you so much. I'm not sure that made me really confident that we can convince all of our fellow citizens, but at least that's gives us an understanding about why some people are doing what they're doing. So I guess that's it for today, and thanks for joining us. You can go to cph.temple.edu/coronavirus to view other videos and find links to reliable sources of information about the coronavirus. So thanks again, and we'll see you in a few weeks.